I was collaborating with other people who were working on testing new drugs, and they told me that also this clinic here also has experience in testing drugs which are also used in humans. So I connected with them and we talked about photodynamic therapy, and we showed them the results we had in our rodent models, and they were very excited about it. It shows also that photodynamic therapy is a very powerful new therapy for us to add to the normal therapies that we're already using.
Are you surprised by the results that they're getting here, or is it what you would predict based on what you've seen?
Well, we actually were a little bit surprised because these animals are much bigger, and we thought maybe that we would have less results because maybe the light penetration, but as expected, we see that there was a very dramatic effect, especially in the bladder cancer, where you could completely open up the ureter, where the animals can pee after that again. So that was really it's a big thing for these animals, and I think also for the dog owners who feel very comfortable with that.
Could you comment on the effects of Bremachlorin-PDT on the immune system and how this might really benefit animals as well that are being treated for cancer?
What we have seen ourselves is that PDT by itself can also induce locally the immune system, which is a good thing because then the immune system can attack the tumor. And what we have seen now actually, which is very exciting, is that if you combine PDT and also further enhance the immune system, for instance by a vaccine or by other treatments, you see a huge synergistic effect. And even we have seen several cures in animals. What is important to know is that during surgery, until now, the surgeon could only rely on his hands and his eyes to remove the cancer. But now if you can light up the tumor by probes or compounds which will specifically be in the tumor, the surgeon can actually see where the tumor is and better remove it and also see the tumor margins. So this is really a big step now in image-guided surgery in oncology, because we can better operate and see where the tumor tissue is. But still the problem is that there might be still some few cells around the tumor. So when we use the fluorescence of the Bremachlorin to completely remove the tumor, at least as we can see by the camera. And then what we do is actually the cells that are spread around will also have the Bremachlorin inside. So if we then in the operation bed where the tumor was put in a light source and then irradiate, then these tumor cells which might be there, which we cannot see, will also be killed by the light.
Could you comment on the use of the Bremachlorin in these animals as far as the favorable tolerability that has been reported?
Exactly, yes. What we have seen is that it's very tolerable, and also we don't see any of the side effects which have been discussed with the use of the other first generations, where you get some dark toxicity and all kinds of other side effects. So until now we haven't seen any side effects. We haven't seen any side effects in the bigger animals here.
Mm-hmm. Based on these findings, are you excited about the possibility for really changing the way that cancer medicine is delivered?
Absolutely. So first of all, with the much better total eradication of the tumor by surgery, so we can do better surgery in combination with PDT, and also by combining PDT with immunotherapy, we have seen now cures which we have never seen. So I think this will be really a breakthrough in the treatment of cancer by combining PDT with immunotherapy and other therapies. So I think we are just at the beginning of a whole new area of treatment where we combine and where PDT plays in an extremely important role.